Hello there. Thanks for joining me. My name's Chris Fitch. I'm a vulnerability lead at the Money Advice Trust. I'm also a research fellow at the University of Bristol. And prior to that, I was a research fellow at the Royal College of Psychiatrists and head of policy and a researcher at Imperial College Medical School, where I not only taught medical students, but was involved in large-scale studies with vulnerable populations who were at risk of HIV infection. What I'm going to do today, I'm going to talk to you about the question that you're going to see on the screen in a second. And that question is around financial and mental well-being. But what I'm not going to do, because there's a lot of information out there, a lot of leaflets, and I'm not Martin Lewis, is I'm not going to give you any money-saving tips or advice around managing your money. Instead, I'm going to focus on the role of the health professional and the contribution of health professionals and possibly your contribution in the future in relation to the financial and mental well-being of patients, service users, and even clients that we might support. And I'm going to try and get you to think about a couple of things. The first one is I'm going to try and get you to think about whether a health professional should not only try to improve the health of their patients, but take responsibility or some responsibility for their financial situation. So something for you there to think about immediately. And then I'm going to push us a little bit more, and I'm going to ask you to think about whether a health professional should themselves push things a little bit more and try to change the way in which the banking system works, so it brings about health benefits for patients. So this is not just about a public health approach as we've understood it traditionally and the clinician or the medical practitioner's role in this, but actually what can we do as a force for social change? And the reason I'm doing this is that one day, if you do pursue a career in healthcare, you'll have patients that need health and financial intervention, and also potential opportunities to influence the wider public health by changing the way in which commercial organisations operate. So I want us to think about these opportunities, and I'm going to tell you about a few pioneers that have really pushed things forward in medicine and health profession around this. So let's move to the next slide. So I'm going to start us off. Now, this might be a while. You might say, Chris, I'm absolutely broke. Or you might say, Chris, I don't use cash. It's kind of, I want you to think about the last time you saw a banknote. Now, Barclays Bank invited me to give this talk, and Barclays are one of the over 300 financial essential services firms that I've worked with at the Money Advice Trust. Now, the Money Advice Trust run National Debtline, they run Business Debtline. We've also got this large program around consumer vulnerability, which draws on lots of the public health work that I've done in the past. And Barclays are one of the firms that have been involved in this. And Barclays have clearly got a lot of money. You know, it's tucked away in a vault somewhere. They won't tell me where it is, but I'm sure it's there somewhere. But I wanted you to think about the last time you saw a banknote, and there is a point to this. So I've got some of them there on the screen for us. You might recognise some of these notes, and some of them might be a little bit less familiar. So you've got like Jane Austen up there on the £10 note in the corner. You've got Mary Kenny in the right-hand corner, and that's a Bristol £10 note, part of their local currency. You've got Winston Churchill, George Best, one there for the older viewer. It's a Northern Ireland banknote, and Luol Deng on the Brixton £5 down at the bottom, who's he was the highest paid British sportsman of all time, understanding the NBA. Now, what does this actually tell us about health? So just have a think about that for a second, about the money in our pocket. Well, let's put you out of your misery. Woven into the fabric, the polymers, the fibres of this note are images of people where they've experienced, like all of us, a range of different physical and mental health conditions over time. So Winston Churchill, not only known for the Black Dog of Depression, but also dementia, so Rabbie Burns, chronic heart disease, James Watt on the 50. I've never seen many of those 50 notes, sadly, in my life, but kind of emotional breakdown and depression, George Best alcoholism, and so on. So the point I'm trying to make here is this, every time that we use money, it's staring us in the face. There's this relationship woven into it between our health and our money. Now, some of you may think, saying, well, Chris, I'm a millennial. You look quite an age, Chris. I don't use cash. Well, it might be an apocryphal story, but apparently the early prosthetic limbs were made out of the same material that you might find in your modern day bank card. So we're all touched by this. Now, Ralph Waldo Emerson said kind of the first wealth is health. And I want us now to think not just about this relationship, but what does it actually mean? And this is something that's coming up a lot in discussions around COVID-19 at the moment, this fine balance between the economic wealth, well-being of the country, and also our individual and our public health. So a recognition of this relationship it's been around for a long time, where Emerson writing in 1860. But as clinicians and as medical practitioners, whatever role you go to take on within medicine, and it's a fantastic career, you will encounter individuals where there's a very strong relationship between their financial situation and their health. This is so the late Dr. Helen Lester, who's one of my colleagues when I was working on the Joint Commissioning Panel for Mental Health, who, if you've never watched Bothering About Billy, it's a must watch. Don't watch it now, do watch the end of this presentation, but do have a look at it. Helen talks about her experience as a GP, working with people who are homeless, at risk of psychosis, and that strong relationship between economic well-being and individual health. And we know from the literature, and I'm putting up on your screen at the moment, some of the summaries of the positions or the relationships between income, money, poverty and health. We know that money buys us health. It can buy us health-promoting goods and engagement in health and social life. Money affects us in terms of psychosocial. We think about well-being, anxiety and stress. I'm an advisory member of the board at Money and Mental Health, Martin Lewis's charity, which is set up to look at this specifically. But we all know it's there, and we'll see this in our patients and in the people that we're supporting in different roles we have. Money affects our behaviours. Look at the relationship between disadvantaged communities and unhealthy behaviours, public health perspective. It also buys us opportunities to improve our health. And if you're not a stats person, here's a visual example of that relationship between money and health. As you move further along the tube line here from Westminster to Canning Town, so increasing social and economic deprivation, we see that kind of years of male life expectancy lost from birth actually begins to kind of drop. So there's that relationship there. So you might be thinking, okay, Chris, this is all fair enough. So, but what have doctors and patients got to do with this? And you remember right at the start, I wanted to push you to think about not only what you can do for individual patients, is that your responsibility in terms of their finances, but also what you might do more broadly. And I want to kind of, a bit like Helen Lester a moment ago, is a real hero of mine. I want to talk about some other people that have really changed some of the research programs, but also they've changed the way in which our banking systems work. And I think these are people that you should be looking to as examples of the work you can do clinically and the work you can do practically, policy, politics, and change. So it affects that money in our pocket. The first is my old boss, Royal College of Psychiatrists, Dinesh Bugra. Now, Dinesh is on the left, and on the right-hand side, we've got a guy, Tim, a research participant in one of the anthropological studies that I ran whilst at the Royal College of Psychiatrists about the everyday lives of people with serious mental illness. Now, Dinesh and Tim have never met, but they've had a profound influence on the way in which society looks at the relationship between money and mental health, or money and health more generally. Now, Dinesh was not only president of RC Psych and then also the BMA, the British Medical Association, a bit later. He did some seminal work with Rachel Jenkins, which statistically, looking at a cross-sectional survey data set from the Adult Psychiatric Morbidity Survey, established this relationship, this association between mental health and debt. And it was one of the first kind of papers that I came across when I was looking at this field. However, we'll look at that in a little bit more detail in a moment. But however, as president of ICC, Royal College of Psychiatrists, Dinesh made it possible for us to develop a medical evidence form that allowed busy health and social care professionals to provide medical evidence to debt collection companies, to banks, to creditors about a person's mental health that would then be taken into account. And that was absolutely sort of revolutionary in that sector, because previously creditors had relied on handwritten doctor's notes. Let's say certain amount of risperidone was being prescribed, which meant nothing to a creditor in terms of the way they might change their debt collection practice for someone who had mental health problems. And Dinesh was absolutely central when he was at the BMA to ending the practice of charging in England for GPs asking for payments to complete what then became the Debt and Mental Health Evidence Form. So Dinesh was absolutely central. Tim, meanwhile, his fundamental contribution as a patient, and we're always talking about trying to get as many patients of our patients as possible into research studies. Tim's contribution was to open up his life to me. Tim was in his 40s. He'd had schizophrenia since his 20s. He hadn't worked for 12, 15 years. He was living on an income of 6k a year, and he ran up £27,000 worth of debt. I wrote about this in The Guardian, going way back in 2005. Someone from the financial services industry saw it. I don't know how. I don't know how many people in the financial services industry read The Guardian. I thought it was the Financial Times or the Wall Street Journal. And from there, a program of research and activity and guidance really developed and got great momentum. And it included developing, as you'll see on the screen here, something called Final Demand, which was an educational resource that went to almost 250,000 different health and social care professionals across the UK. Now you can see on your screen a few of the statistics around the relationship between debt and mental health and sort of money and our health. And I'm not going to go into lots of these here because you can see them and you can read the wider literature. But I want us to be really, really clear, about us as practitioners. We're exposed to our patients, the people that we're supporting in different roles who are experiencing these problems. And we can make interventions. We want to ensure that the 1 in 2 British adults with a debt problem who also has a mental health problem, that figure changes in a positive direction. We want to make sure that actually the way in which commercial firms operate who collect debts, it actually takes mental health and health into account. Now, you may say I'm a bit of a dreamer or an optimist, bailiffs, enforcement agents, what do they care about mental health? Maybe we'll come back to that a bit later on. But I want to just leave that thought in your mind about Dinesh and about Tim. And I'm going to talk about 2 more people who are real heroes of mine. So you've got Dr. Henrietta Bowden-Jones on the left, and you've got Owen Bailey on the right-hand side. Now, if you want to hear them talking about their area of expertise, which is addiction, Etta runs the National Problem Gambling Clinic in London, which is the first NHS clinic on gambling disorder. Owen is one of the former patients, I believe, of that clinic, but is now a writer and activist around gambling. And they both see gambling and addiction as a public health problem. And it's often talked about gambling being the new tobacco. Now, what's absolutely critical about the contribution they've made, and you can hear more about it, if you search for Vulnerability Matters on your podcast provider, you can hear them talking alongside Monzo about the work they've been doing around gambling and commercial firms. And alongside Natalie Ledwood at Monzo, they were really important in bringing around the Monzo gambling block. So just very, very quickly, the gambling block, when you switch it on, puts in place a lock which stops you then spending your money on gambling using your Monzo card. And it's been replicated. It was started by Starling Bank, but it's been replicated across others. And when you want to try and turn the gambling block off, to deactivate it, you have to wait 48 hours. There's a friction. Now, this has come from a partnership between clinicians, researchers such as myself, and also commercial firms. And this is something that you could be involved in. And over 200,000 Monzo customers use this. So I'm at the end of the presentation now. And really what I've tried to do is just plant some seeds. And those seeds are to think about the individual well-being of your patients and the people that you're supporting in terms of their health and their finances. We looked at that relationship between the two. So bear that in mind in terms of those clinical encounters. What can I do? Don't just refer someone to Citizens Advice like a silver bullet. It's great to do referral and signposting, but actively try to understand in the time you have, what the financial situation might be and what you can do within the parameters of your responsibilities and the opportunities that you have to help that person. And secondly, we talked about the role of these pioneers in changing the way, not only changing the way in which clinical practice works, not only changing the ways in terms of the traditional way we think about public health, but thinking about those other commercial spaces that we can influence as practitioners and professionals. And I've mentioned some of the resources that have been developed, some of the research on the right-hand side I've been involved in, and some of the fact sheets and the materials, and you can look at them at your own leisure. But I just want to end with these 2 final quotes. We've had a lot of statistics. We've had some kind of case examples in here to a certain extent. The first one is Larry Dossey. Now, not a well-known name. He's an editor of a journal called Exploration. But he reminds us that debt is too important. Unless we can use debt here, we can use money. Debt on money is too important to be left to economists, financial planners, and politicians. We have to begin to view finance, money, debt as a health factor, as real as blood pressure, cholesterol, and body weight. And I want you to really, really think about that in terms of your progression through your medical, your clinical, your health career. What can I do about this? Don't just push it to one side. And then the last one, for those who go down an academic route or more statistically minded, the classic quote from Austin Bradford Hill that the epidemiologist we've all probably heard of in terms of his work is that health statistics represent people with the tears wiped off. So these are, every single one of those stats is based on data sets from a real person with real problems in real time and in real need of help, not just from economists, financial planners and politicians, but from health professionals. So is financial well-being any business in medicine? Absolutely. And critically, as medicine becomes part of your life, thinking about financial and personal well-being needs to become key to your practice. Thank you.